Well, many folks here in South Mississippi may be dealing with vision loss problems, and that's not a conversation that's very easy to have, which is all. We bring in the specialist, Dr. Regan, with Retina Specialists of Mississippi. How are you?
I'm doing well, thank you.
Thanks for being here. So tell us a little bit about what you do here.
So I am a full-service vitreoretinal specialist. We do eye surgery and eye treatments of various eye conditions and disorders of the retina and vitreous.
So we were talking a little bit before we started this segment that a main focus, or not a main focus, a main challenge that you have with clients that are coming in is diabetic related. Tell us a little bit about that.
Sure. So diabetes is very common in this state, as it is, all over the U.S. and even the world. It's the leading cause of permanent vision loss in the world. Mississippi is no different, and there's a large percentage of patients in the U.S. With diabetes. And what's striking is that of those patients, of adults who have diabetes, almost a quarter of those patients don't even know they have diabetes. And a large percentage of patients with diabetes have what we call diabetic retinopathy or diabetic eye disease, which can result in varying degrees of vision loss, but it can be permanent. And so there are many people around, even as we're having this conversation, that at risk of losing their vision or actively losing their vision, and they either don't know they have it or are just kind of not even knowing what's going on. And so that is a big component of what I do, is treating diabetic eye disease. It is a potentially very treatable thing, but it's a very common thing we see around here.
So for folks that are watching that may be curious as to, is this something that I need to be thinking about? Is this a question that I need to be asking a doctor? What is the first sign? Like what will they be noticing even right now as they're watching the show? If they're beginning to experience it, they don't know, what are some of the things you can help them understand so that they may know whether or not they need to come have a conversation with you?
Sure. So a big thing that I'm going to try to make a point of is that all adults should have eye exams. And the misconception, the myth is that if my vision is fine, if I'm seeing good, I don't need an eye exam, I'm healthy. And that's a big myth. All adults should have at least an annual eye exam, and almost 40% of adults in the U.S. are at risk of some type of vision loss. What are those things? Age over 65, medical conditions like diabetes or high blood pressure, eye conditions or potential eye diseases with vision loss. And another important thing is that, or a remarkable thing, is that of those 40% that need annual eye exams, less than half actually get annual eye exams. And so I don't want to make a point that, look out for these symptoms. The number one point I want to make is that adults should get an annual eye exam anyway, and that's a good way to find a lot of problems. But some common things you can look out for are worsening vision with or without glasses, blurring vision, floaters in the vision or visual disturbances, missing parts of your vision, dimming vision, peripheral vision loss. All of those things should prompt you to get a relatively urgent eye exam.
And we're not talking about a vision test, like a when you can see here. It's like for you and I, like I'll go to the eye doctor and have my prescription checked, make sure that my glasses are right. We're talking about something a little more than that.
A total eye exam involves not only checking the prescription and checking your vision and seeing if there's a refractive error that can be fixed with glasses or contact lens, but really a full eye exam involves looking in the eye and dilating the eye to look inside of the eye, because that's where the retina is and that's where retinal pathology is going to be identified. And so if you're not getting a complete eye exam involving a dilated eye exam, you're missing out on a big part of the eye exam that can diagnose and catch these conditions.
So for folks who might be nervous about that, like I don't like to think of anything invasive happening in my eyes. I kind of like them the way they are. Walk your potential patients that may be watching this right now, walk them through what that looks like when they come in the office. What does that test look like?
Sure. So for routine eye exams, they're not painful and they're not really uncomfortable. Sure, you'll be dilated, and dilating can be a little bit annoying. And trying to read your phone and read up close can be a little frustrating for a short time. But a routine eye exam shouldn't be painful or uncomfortable. And I don't want to have patients have any anxiety about it. I don't think patients should be anxious about going to see your eye doctor, because I want people to feel empowered about taking care of their health and being proactive about their vision and eye health, and that involves going to get the eyes checked, and that will tend to allay people's fears and anxiety. Is at least you're knowing what's going on, you're knowing what's happening. So the first step is going to get checked out. For patients that are coming into my office, those patients may have a little bit more anxiety because of what they've heard about retina specialists and what we do. And certainly we do some a little bit more invasive procedures than other eye doctors, and we do them here in the clinic. And things like hearing about eye injections or laser procedures can be somewhat anxiety inducing, but that's why we try to have a pretty comfortable environment here and have patients feel comfortable about coming in here and asking questions, and then educating patients on what they have can make them feel more at ease and comfortable with what they know they need and any potential treatments they may have. And I like to walk patients through all that before we even touch those topics of need things, and that way patients can feel more comfortable about getting those things. But certainly, yeah, absolutely, you can have anxiety about coming in to my office specifically about those things, but importantly, it's just taking power and taking control of your own health and coming on in, and then we'll worry about the rest.
Oh, and the majority of what you're doing is happening right here on site.
That's correct. Most of what we do happens right here in the clinic. We do most of our procedures right here where we're sitting. We do eye injections and laser treatments here in the clinic. If we do need surgery, which we perform quite a bit of surgeries every week, we end up going to one of the local hospitals and we do procedures in the operating room as well.
We have about 90 seconds left. So tell our viewers, is there any other conditions that you treat here that maybe they might want to be on the lookout for?
Sure. So increasing in prevalence is age-related macular degeneration. We see it more commonly as we get older. And patients can lose vision pretty precipitously from that. There are a couple of different forms. There's wet macular degeneration and dry. We have treatments available for both forms. And so it's a good time, a better time for patients with macular degeneration than in the past. And we have treatments available to help patients preserve their vision and keep it for as long as we can. And then another big thing that we treat are retinal detachments and retinal tears. We also address other things like floaters and some visual symptoms like that as well.
I guess the key is making sure that you're staying ahead of it. If there's any challenge or any irregularity that you're noticing at all, start asking questions, make a phone call, because it's easier to proactively treat something than it is to reactively treat something.
Right. I have treatments available now. I don't have a time machine, so I can't go back and fix these things. And so the sooner you get on it and get seen and checked out, whether it's by me or someone else, another qualified eye care provider, the better off you're going to be in the long run. And the vision is not something you want to gamble with or mess around with. I can't replace your eyes, I can't replace your retinas, so the two eyes you've got, you're stuck with them forever, and so you want to take care of them. And that means getting it checked out if you're concerned.
Well, there you have it. Listen, if you have any questions, you see that number, the website at the bottom of your screen, give them a call. They'll be able to help you out. Dr. Regan, thanks so much.
Sure, thank you.